As people across the world continue to adhere to COVID-19 guidelines, some are being hit with waves of loneliness. A Wired UK piece titled "The Weird Science of Loneliness" explains why lockdown sucked. That's a great title. And looks at how COVID-19 and social isolation may impact physical and mental health. Writer of that piece, Matt Reynolds, is with me now. He's a science editor for Wired UK. Matt, I love the title because it is absolutely true. It's exactly how so many of us felt, but let's talk about the science behind why lockdown sucks so hard. The pandemic has allowed a scientist to study a new neuroscience of loneliness in ways that they really haven't before. So what are they saying about what loneliness does to the human brain?
So what we've known for a while is that social isolation is linked to worse physical and mental health. People with weaker social connections seem to have a 50% higher chance of dying in a set time period than those who have strong social connections. But until recently, we didn't really know why this is. There's a couple of studies that are kind of shining a little bit of light onto this. One, there are these kind of neurons in the brains of mice that seem to respond to social isolation. If you stimulate them, mice seem to be more keen to go out and seek other mice. And if you turn them off, their desire for that interaction goes away. And we can't see human brains in the same way, but we do know that if you starve people of social contact for 10 hours and then show them photos of social cues, handshakes or people smiling, their brains respond with a kind of craving response pretty similar to if you were showing hungry people images of food. So it suggests that loneliness or social interactions is kind of basic need, not totally different to hunger or thirst, that people want to seek out on a neurological level.
Why is it weird? Because part of the title is the weird science. Why is the science so weird?
I think it's weird because we never quite understood the neurological basis of this, right? We understand stress. There are very clear signifiers. If you're stressed, you have these signifiers, cortisol levels go up. If you have anxiety, you have certain changes in the brain that you can measure. So we can really understand what's going on with these experiences on a neurological level. Now, loneliness is a little bit more vague, isn't it? Maybe I get lonely if I don't see anyone for 2 days. Maybe you're fine for a week, 2 weeks, right? You're less bothered about it. So the reason it's weird is that we're only just starting to understand what's going on a neurological level. You might be able to say, okay, I can see why this person is being, feeling lonely. I can see what's driving this experience. And it's weird because we've never really seen it before. We've never looked at loneliness in this way.
So in reading your article, and it suggests that people with stronger social relationships are more likely to survive in periods of social isolation, which also struck me as kind of weird because I would think that if you are a loner or, the type of person who is an introvert and doesn't have a lot of relationships, that you would be thriving under a lockdown. But that's not what you found. Help me make sense of that.
Well, I have to say, it's really difficult to know exactly what this data tells us. So people who are socially isolated seem to have worse health outcomes over a certain period of time. That might be because there's some kind of long-term effect that loneliness is having on them. There are some suggestions that loneliness is linked to inflammation, which is, underlies all kind of health conditions. It might be something different, right? It might be that lonely people are less likely to be convinced by a partner or a friend they should go to the doctor, so they might be less likely to seek out help. So we don't know exactly why this is. I think one good thing about the pandemic is that we're starting to think about loneliness more, and hopefully we're going to find some answers because of this experience that we've all been having.
So now, as more cities ease COVID-19 restrictions, we are seeing more incidences of some of the things that we hoped we wouldn't see a return to, including active shooters. There have already been 133 reported mass shootings in the United States this year alone. What did the science tell you about loneliness and how that could be playing out in some of these instances?
So loneliness is super important, and we should be thinking about it as a public health concern. But I think it would be a really big mistake to think about loneliness as a root cause of mass shootings. A much more direct cause is just access to firearms. We know that access to firearms is correlated with deaths from mass shootings and death by suicide, which makes up more than half of the gun deaths in the US. So, for instance, there's a survey in the UK, 3.7 million people are saying they feel lonely right now, more than they did in spring, and it's kind of going up. But we don't have any mass shootings over here. Very limited access to firearms. So I think that we should be really clear when we think about loneliness or other mental health conditions that are linked to mass shootings, because there's a much more direct, obvious correlation that you can point to, and that's really just access to firearms.
Yeah, that would make sense. What are some of the things that people can do now to curb the negative impact of social isolation as we still grapple with COVID-19? Because it's not over with yet, and in Europe, not the UK specifically, but on continental Europe, there are still folks who have not been vaccinated. The vaccination efforts are going at a much slower rate than they are for you in the UK and me here in the US.
Yeah, I think a really simple thing we can do is kind of think about and talk about loneliness a bit different. I think perhaps before the pandemic, someone said they're lonely. You might have thought, well, they're a bit weird. Why does no one hang out with them? Why don't have any friends or whatever? But actually what this research suggests to us is that actually saying you're lonely might not be that different to saying I'm a bit stressed or I'm thirsty, right? It's just a thing that you want to seek out. So I think one thing you can do is be less judgmental and actually be more willing to reach out for people. But also, as places start to open up, it's really important that you start looking at the value of expanding your network. There's evidence that even if you think you got loads of connection because you have a house full of kids, or you work in a big office, actually it's really worthwhile building your network, thinking, what am I doing in the community? There's also some evidence that cultural events might have some protective health benefits. So are you going to a gallery? Are you going to a sports game? So I think it's about thinking about loneliness as part of your overall health and being a bit forgiving, right? If you want to go out and see someone, you don't need to justify it to yourself. You're actually, I don't know, maybe you're doing yourself something good for your health. There's another reason to go to the bar or something.
Yeah. Before I let you go, Matt, one of the things I'm curious about now that I think about it and think about your article, it's interesting that now we are doing research on this because there have been other pandemics, there have been other crises in civilization that have forced people to perhaps not interact with their fellow man and woman the way that they might have before those crises. But it's interesting. One of the things, there's a great book called, and I've referenced it frequently on this air, Man's Search for Meaning by Viktor Frankl, which he was a Holocaust survivor. And he was a psychotherapist, a psychoanalyst. He talked about one of the things that he came to understand about people who find themselves in stressful situations is the notion of hope. And that hope can have a powerful effect on the brain and how we get through things that are very, very difficult. I wonder if with the discussions you had with some of those scientists that they talked about that. Like for me, for example, having read that book and having lived through this pandemic like everybody else, my focus was always on when this is over. And I never put a time frame on it. I never said, well, I can't wait. Scientists say it could be over in 6 months, so I'll focus all my efforts on 6 months. I was always like, whenever it's over, and I'll hope for that moment. Is there anything that you've uncovered in your reporting and your research that suggests that also works?
I think that's a really, really good point, because although perhaps I don't know about specific research around hope, it's worth pointing out that although a lot of us feel socially isolated now, we might find that as soon as we start getting back with friends, that actually that falls away, right? So it's not like you necessarily will have long-term health detriments because of this. And also it's really worth noting that we've thought about new ways to socialize, and actually we might find out that, yes, for a long time people didn't see people, but actually the benefit of those Zoom calls, the benefits of those video calls, of those getting on the phone to your grandmum or whatever, actually they had a protective benefit as well. So we might end up finding out that actually there are other kinds of social interaction that might be beneficial. So hopefully this will give us perhaps other social options as well, and realize actually there's a lot more to our social lives that we could be pulling on and doing, and that actually we can take that knowledge into the rest of our lives and hopefully be a bit more forgiving to ourselves.
I'm a much better guitar player than I was before the pandemic, Matt, and I'm also now able to do puzzles. Which I didn't like to do before the pandemic. Matt Reynolds, really, really great to talk to you, man. Thank you.
Thank you.